Today I'll be talking to you about Volunteers in Medicine Clinic located in Helena Island. There's also another clinic located in Bluffton, South Carolina, but I'll be focusing on Helena Island, South Carolina. Here I'll tell you an amazing fact about your country, state, and your own county. 45 million of our fellow citizens in the United States of America do not have health care. In South Carolina, there is 132,000 uninsured children, which means more than 1 in 9 children in the state do not have health insurance. The total population of Beaufort County is approximately 163,000 people, and from that, about 21.6% of those people do not have health insurance. Due to that, today more than 10 working-age South Carolinians die each week from a lack of health insurance. This video will show you some of the work Dr. McConnell had when he first came to Helena Island, South Carolina, and the background of how Volunteers in Medicine was founded and created.
When I was driving outside the plantation or the development, I would pick up people who were walking alongside the road and give them a lift to wherever they were going, back to the house or to the work site. And I invariably asked them where they got their health care. And they invariably said, I don't get any. That to me was unbelievable. Well, we had two problems. We had the problem of those who had no access to health care. And we had the problem of those who lived on the island who had no easy way to deliver it. So I brought those two problems together and I made a solution out of it, which we call Volunteers in Medicine Clinic. And now I'm told now that every person that lives in our town has access to health care, and we are the only town in the nation that can declare that.
This video made by Dr. Jack McConnell has inspired me in many ways of things that I can do in the future to make this island or town a way better place. Like his idea was creating Mitt. My idea could be creating upon that or building something different. But I want to do what Dr. McConnell just did, help this place become a better place. And that's what shows a good character of a good citizen. The construction process is where the Volunteers in Medicine Clinic building was taking place to building. There is multiple buildings. There's one for administration, patient care, and dental. There are 25 to 30 certified constructors who helped decide to make this building, and they want to be remembered for making this building because they knew right inside their heart and their mind that one day this organization will rise. Maybe not be today, maybe not be in a couple years, but in the future, this organization will have the impact on the society, and they want to be remembered like Dr. Jack McConnell's got to be. The grand opening was in 1993, and when the Boys and Girls Club came over and helped Dr. Jack McConnell cut the ribbon for the grand opening of Volunteers in Medicine. They're looking up to Dr. Jack McConnell's role model, things that they can do to make this society a better place, or even little things to make it a chain where one person sees it and they do it, and so on. So basically to them, Dr. Jack McConnell is like their role model, or their figure they have to look up to all the time, even if they quit. The founder of Volunteers in Medicine is Dr. Jack McConnell. He first opened his doors in 1993, and his first patient came in February 1993, which was a little girl who was between the ages of 3 and 5. He was also one of the founders of Tylenol at Johnson & Johnson, surprisingly. I didn't know that. It all started when Dr. McConnell was driving around Helena Island, South Carolina, and saw many poor people, such as Native Islanders and others, who came onto the island to work. They wanted to help support tourism, but they didn't have access to health care. That was when he saw the need for health care. Dr. McConnell remembered that when his family would sit around the dinner table, his father would ask him, "What have you done for someone today?" He wanted to answer that question right now when he opened Volunteers in Medicine. Here and then we have multiple missions, but our primary vision of the Volunteers in Medicine Clinic is to understand and serve the health and the wellness needs of medically underserved population living and or working in Helena and plus these islands, even if they're just helping to support tourists. At the same time, we also have our own vision, and the main one is, may we have eyes to see those who are rendered invisible and excluded, open arms and arts to reach out and include, healing hands to touch their lives with love, and in the process heal ourselves. This vision was made by a famous person, Dr. Jack McConnell. Here at Volunteers in Medicine, we have three major goals. The first goal is to help the medically underserved people. That is the main reason why we had opened this building. Our second goal is to promote wellness and preventive medicine, which is our wellness program. So basically, when the patient comes with a prescription, the pharmacist review it, give them medication that they need, whether it's to reduce the pain or to give it for the food or whatever it could be. And also, when you enter in the building, there's a wellness and non-wellness side. Basically, if you're well, you go to the wellness side. If you're sick, you go to the non-wellness side. So we do that because if we don't want people who are sick to become sick. Our third goal is to treat our patients with respect and dignity, because if we do not do that, then they will tell their friends that this place is a bad place and it's not worth coming in. But that is why we treat them with those two vital things, because that is what patients really look forward to. They also want their family to have a good time there. And they will then tell the front desk what a great job this place has done and treated them, and then they'll spread the word to millions of people that they know. Then those people spread out to the other people, and those people spread out to those other people. So basically it's just working like a little chain. We also have three major accomplishments. Our first accomplishment is that we have 3,400 patient visits every year, but that number has been increasing every year, so that means our organization is on the great path of becoming popular and popular again and becoming well known. Our second major accomplishment is that we have comprehensive medical care, which means that any kind of doctor, and we have 23 medical specialties. Like we have pharmacists, nurses, doctors, physicians, chiropractors. Basically, like anything you can see in a hospital, we have right here in this building. Our third major accomplishment is that we're self-sustaining. We do not depend on government funding. We get various foundations and fundraisers from national organizations like Avon, Komen, Pfizer, and Craigslist, and local charitable foundations like Bog and Box Community Foundation, local Rotary clubs. We also get some from churches also. Volunteers in Medicine makes a positive impact on our community in many different ways. First of all, it provides free health care to the people who do not have access to any at all, as well as serving 6,000 patients every year. It also provides a dental clinic, which opened 3 years ago. Since tooth decay and tooth pain are the number one reason why kids and parents miss school and work, the clinic has had a major effect on improving the dental health of these patients. Another reason why VIM is important to our community is to keep people out of the emergency room. The hospital will not be able to handle all the people that live on the island, but that's not a problem thanks to VIM. Last of all, by keeping the islanders healthy, we maintain the beauty of our surroundings. And if VIM did not exist, thousands of island employees and their families will be cut from medical, dental, and mental health care, and our hospital's emergency departments would be left to absorb thousands of additional visits each year, resulting in overcrowding, longer waits for all, decreased profitability for the hospital, increased costs for the insured consumers. There's a various amount of ways we spend our donations. 88.5% are spent on patient care, anything from medication to surgeries, and the other 11.5% is spent on operations on salaries of employees, the water bill, electric bill, TV bills, and etc. We always have volunteer opportunities open to the community. You do not have to have medical field experience, but if you do, that would be also a great thing. We have doctors, pharmacists, physicians, chiropractors, nurses, volunteer opportunities available if you have experience in medical field, but if you don't, we have lay volunteers which do marketing. But before you can volunteer, you have to come to a volunteer session where you learn the importance of being on time, and the rules, the expectations, and all that fun stuff. You can contact Volunteers in Medicine in many ways. Their website is www.vimclinic.org. We are located on 15 Northridge Drive, Hillnet Island, South Carolina, 29926. The Patient Care VIM Clinic building's number is 843-681-6612. If you want to email the dental clinic, their email is dentalvimclinic.org. And their extension number is 233, and the phone number is the same. Here's the first part of work side where I've got all my information and pictures and all that stuff from. And here's my other part. Thank you for listening to my video, or my presentation. And I hope you had a fun time learning all the information about the Volunteers in Medicine Clinic located in Helena Island, South Carolina, at 15 Northridge Drive, Helena Island, South Carolina, 29926. If you have any questions, please contact Volunteers in Medicine and we'll be happy to answer your questions. Thank you for listening.